Hello, everyone. Welcome to our fifth and final episode of RelTalks, our speaker series where we highlight research of up-and-coming relationship researchers. This is sponsored by Relevate, which is a multidisciplinary team of researchers and all kinds of people, really, with the intention of taking relationship researcher and bringing it to the people. So here to bring her research to the people is Kristina Cordero. Kristina is a third-year PhD student in the Clinical Developmental Psychology program at York University in Toronto, Canada. Supervised by Dr. Robert T. Muller, her research has focused on intrafamilial trauma and attachment-based treatments for children and their families. Most recently, she's been collaborating on a large clinical trial of the effectiveness of emotion-focused family therapy for caregivers supporting children living with mental illness, and she has been studying the clinical benefits of using the adult attachment interview as an add-on to therapy. Her research has been recognized by the International Society for the Study of Trauma and Dissociation, and she has received numerous grants in support of her research and clinical training. Kristina has over 10 years of experience working with children and young families in educational and clinical settings, and is a trained behavioral therapist. Currently a master's level clinician, Kristina works with youth, adults, and families presenting with a variety of mental health concerns in several community-based settings, providing both assessment and treatment services. She is passionate about increasing access to effective and timely mental health services and considers the caregiver-child relationship to be a critical entry point for preventative interventions. Her hope is to affect systemic change in how we involve parents in the treatment of their children. And as a mother and caregiver, Kristina likes to spend her non-working time with her family, enjoying their company and going on adventures together, backpacking, scuba diving, skiing in times where maybe that was more possible to do potentially. So before I turn it over to you, Kristina, for those of you who are in attendance now, if you have any questions throughout any time in the presentation, please just go ahead and use the chat feature at the bottom of your screen. So you click chat and you type it in. The chats will come to me and I will ask Kristina those questions at the end. You can do it at any time though. Please leave your mics and cameras off for the time being. But without further ado, Kristina, I'm going to turn it over to you.
Wonderful, thank you. Let me just get my screen up here. Y'all can see that? So first of all, thank you, Eric, for that lovely introduction. And I'm so pleased to be here this evening to talk about what I think is a very important issue in child mental health care. So that is how we work with children and caregivers and why we need to fundamentally shift the way we think about and engage parents in their child's treatment, placing parents at the heart of their child's mental health care. As Eric mentioned, I'm a PhD student at York University, and I've dedicated my education, training, research to areas of intrafamilial trauma, attachment, and parenting. But on top of having kind of an intellectual and professional investment in parenting, I also have a very personal reason for the work that I do. So this cutie that you see here is my 3-year-old son, Lucas, who has gifted me a sense of purpose and meaning and a depth of love and joy that I honestly couldn't have imagined before him. And parenthood has also given me a sense of exhaustion, incompetence, and guilt that I couldn't have imagined before Lucas. Funny enough, given all of my expertise in child development and my many years kind of consulting and giving advice to parents, I was pretty ready to be a mom. And then Lucas was born. And I realized immediately that it's easier to parent somebody else's child than it is your own. You know, when you don't have that option anymore of passing that kid on to their parent at some point down the road. And I came to know in a very intimate way just how what goes on inside of me, my own kind of history, is very much alive in my relationship with my kiddo, which is something I hadn't really known. I had known theoretically, but not at the same level that I do now. So why do I care so much about parents and caregivers? I've dedicated the last 15 years of my life to working with children and youth, and inevitably working with kids has meant working with parents and caregivers. Even when they aren't directly involved in therapy, parents are there. They are almost always the ones bringing their kids to sessions, sitting in the waiting room. I get voice messages and emails from stressed out parents who are lost and overwhelmed and who just don't know what to do to help their child all the time. Even in my work with adult trauma survivors, parents are there in spirit. As my clients start to unpack their life narratives with me, their stories inevitably turn to childhood. to a history of fear, of hurt, of unmet needs, of a yearning for the love of a parent or the need to feel seen. You see, regardless of age, parents hold a significant role in our lives throughout our lifetime, even when they are gone. When it comes to supporting child mental health, the reality is that mental health conditions greatly impact the family system and influence caregiving style. And parents are the ones on the front lines. They are the ones in the trenches. So let's talk about parents of children with mental illness. And although it is widely accepted, and I'm sure that most of you would agree, that parents play an important role in their child's mental health, parents have traditionally been given a minimal role in their child's psychological treatment. In fact, often they're given a role that's sort of secondary to the therapist. But over the years, research has really started to show us that actively involving parents in treatment is a key to effective treatment. So involving parents in their child's treatment actually results in better outcomes for children, but also overall better family functioning. But is simply involving parents enough? I really do think that parents' emotions are important too. Parents of children with mental health concerns, they feel stressed, fearful, helpless. They blame themselves for their child's struggles, and frankly, they feel blamed by others, including their child's therapist. I often get the sense, parents don't say this, but I get the sense when they come in and drop off their kids that they're like, here, I've screwed him up. I don't know what to do. I'm just going to mess things up. You're the expert. Take my child. Please fix them. And I think that when we clinicians neglect to empower parents, we're sort of reinforcing that message to them and making them feel even more guilty or shamed. And this is huge because research shows that parenting self-confidence, so their belief in their own parenting ability, is one of the keys to successful recovery in child mental illness. And how parents respond to their child's distress or mental illness can either greatly facilitate or impede a child's resilience and recovery. But we parents can really struggle to follow through with the strategies we've learned or what we know we should do. And it's not out of a lack of motivation or because we don't care or we don't understand what the techniques that we've learned. It's usually because we're afraid. We're afraid that our child's going to get worse or that we're being too soft and not preparing them for the real world. And I think this is especially true for parents and caregivers who have a history of intrafamilial trauma, whose own pain or traumatic memories are triggered by their child's intense dysregulation. It's like Dr. Shefali Tsabari said in one of her talks, and I absolutely love this. She says, "We don't hurt our children because we're ill-intentioned. It's certainly not out of a lack of love. We hurt our children for one reason only, because we are hurting ourselves and we barely know it. It's baggage from our own parents that lies dormant, unconscious, waiting to be triggered at a moment's notice. And who better to trigger us than our children? They just know what buttons to press." And so we as parents need to attend not just to our children, but to what is happening inside of us. And we need compassion and empathy from others. I truly believe that it's only then when we can actually recognize and step around the things that block us from supporting our child in the way that they need us to. So I hope by now I've made it clear that we need to empower parents as lead sources of support or agents of change in their child's mental health treatment. But the question remains, how do we do that while also directly working with parents' own fears and hurt and feelings that make it difficult for them to follow through with the strategies that we're trying to have them implement? Well, this is where emotion-focused family therapy, or EFFT, comes in. It's a pretty new approach to working with families that I'm very excited about, essentially based on their belief in the extraordinary healing power of parents and their faith in parents' ability to overcome their own fears and pain to become their child's emotion coach. Doctors Joanne Delhonte and Adele LaFrance, they developed this really beautiful way of working with caregivers. Now, I could probably spend like a day talking about this intervention, which we don't have time for. So I'll just boil it down to the basics. Essentially, by combining psychoeducation and in-session practices, EFFT works with caregivers to teach them concrete skills in 3 areas. So teaching them to become their child's emotion coach, to engage in relationship repair, and how to become their child's behavior coach as well. But the key here is that at the same time, while they're doing all of this, the EFFT therapist helps parents identify, process, and resolve their own emotion blocks. Those are feelings like fear, shame, anger, resentment, hopelessness, frustration, blame. Those difficult and sticky feelings that we get as caregivers that, if left unprocessed, will interfere with our ability to follow through with the strategies that we learn. They basically block us from doing the things that we want to do for our kids, sometimes even leading to not so helpful reactions, most commonly around emotion avoidance. So we see forms of denial or accommodation and enabling behaviors. Some parents become over controlling or very critical of their child. So I want you to think of emotion blocks as those conversations that we all have in our heads that get in the way of our best efforts, blocking us. And I'd say this is true for everyone here. Even therapists have their own emotion blocks, and we definitely run into these in all of our relationships. I think it's this focus on processing parent blocks that is the most critical part of the work that is done in EFFT. It's also what makes EFFT trauma informed. So we recognize that parents not only experience great pain in seeing their child suffer, but they also may carry with them their own histories of childhood trauma. And we understand that it's often these painful histories where our emotion blocks originate from. Out of necessity, of course, as sort of an attempt to protect ourselves from further harm or further pain. And in this way, we can understand emotion blocks as kind of like defense mechanisms. The idea, though, is that by helping parents identify where they are getting stuck, bringing those emotional blocks into awareness and processing them, while at the same time focusing on repairing their relationship with their child, parents can be freed from these old, automatic, not so helpful ways of responding, and instead become better attuned and supportive of their child's needs. So in a way, disrupting that intergenerational cycle of insecure attachment and parenting and trauma. So here I am talking about how parents feel to blame. And at the same time, I'm saying that they're kind of the ones with the greatest power to heal their child. So it's sort of a dilemma, I guess. And because parents often feel so guilty or to blame for their child's struggles, we spend quite a lot of time at the start of EFFT providing some psychoeducation about the many determinants of mental health. We actually show this diagram to caregivers. And of course, we all know that parenting is not the only factor at play when it comes to the causes of mental health symptoms. There are many influences that shape children and impact their mental health indeterminably. And we want parents to understand that it is not their fault. We've got things like genes, like maybe there's a family history of anxiety or whatnot. But as far as I know, there's not much we can do about genes right now. There's epigenetics, cultural factors, life stressors like a pandemic. And while we can figure out ways to manage stress, I still haven't found a way of totally avoiding it. Then there's emotional avoidance, so trying not to feel what we feel. And this might not be one that we think about a lot, but it really exacerbates mental health symptoms. So emotional avoidance is sort of like what drives people to do whatever it takes not to feel. So I want you to look at this and think about, what do we actually have influence on? Where do we have control? Really, there are only two bubbles where we actually have control. That's family environment, so our family relationships, and emotion avoidance. And this is where us parents hold transformative power. So these are the two sort of bubbles that we focus on in EFFT. And actually, that's why it's called emotion-focused family therapy, because that's where we want change to happen. So like Dr. Greenberg, I truly believe that every bad behavior or symptom can be understood as a not so helpful response to strong negative emotions. So in this way, we can kind of understand all mental illness as an issue with emotion dysregulation. And so symptoms are kind of our ways of coping with or avoiding painful emotions. And if that's true, then emotion processing has to be the key to recovery. In other words, you have to feel it to heal it, or the only way out is through. So if your child is afraid of elevators and you never go into one, they're never going to get over it. They have to get into an elevator and feel that fear first. But of course, it's hard to do. And parents often actually show up, I think, wanting behavioral strategies. So they're asking for exact steps on how to fix things. But we actually spend so much time on slowing this down and focusing on having them learn how to sit with and tolerate their child's emotions and their own emotions. Because the only thing worse than feeling pain is not feeling it. It just leads to a lot of issues down the road. So now I'm sure everyone here knows just how important validation is. And I guess it's sort of like a hot topic. We all know it's important, but in practice, it's much easier said than done. It sounds simple in ways, but often something gets in our way. Why? So I want to invite you to try something with me tonight just to demonstrate this. I want you to close your eyes and imagine your child or a child that you really care about if you don't have your own child. And I want you to really do it. So try to see if you can imagine the child in your mind's eye. What do they look like? Now imagine that they come to you upset and crying. They're just so sad. And they tell you that they're a complete loser at school. Nobody wants to be their friends and everybody hates them. What is your first reflex or instinct? What do you immediately want to say to that kid? If you're like me and most people that I ask this question to, it's probably something along the lines of, that's not true, I like you, you're great. And what do we notice about that first instinct? Well, it's avoiding emotion. We're telling our child, no one feels that way about you. And why do we do that? Not because we don't care, it's the opposite. We want to free them from their emotional pain. Their emotional pain also causes us emotional pain. Sometimes we don't agree with how they're feeling or understand why they feel the way they do. And frankly, I think most of us aren't taught how to respond to emotions like pain, anger, vulnerability, or hopelessness when we're young. And so I've really come to see how people get stuck the most when it comes to validation. In fact, they often tend to bypass it without even realizing that they're bypassing it, which is such a core component to emotion coaching. And I think anything else we might try when we're working with somebody who's feeling something intensely, like problem solving, frankly, won't work if we don't spend enough time validating. Because, and this is what one of the parents who attended our workshop said, because never in the history of calming down has anyone ever calmed down by being told to calm down. I would also argue that even with young kids, you'd be surprised at how often you don't even need to problem solve when you actually validate well. Even my 3-year-old can move on or come up with a solution after he feels heard or seen or like his feelings have been accepted. So let's zoom into this piece tonight together. And let's see if we ourselves can find ways to slow down when we are connecting with our children or our partners or any of our loved ones. And I'm going to start this by sharing some tips from EFFT on how to make space for feelings and validate the heck out of them. So in general, validation comes after first noticing that something is happening. You're noticing that there's a feeling here. So the first step is to make space for the emotion with acceptance, which involves maybe moving closer to the person or to the child or the person, finding ways to communicate caring non-verbally. You might start to give words to what's happening or describe what you actually see. So if you're hearing your child stomping around upstairs, you might just poke your head in the door and look at them and say, I heard some noise coming from in here, just to sort of show them that you're there and ready. The second tip that I want to give is to know thyself. So as you're noticing what is happening to your child or the other person, make space for your own emotions with acceptance. That means you have to notice what is going on inside of you too. What are you feeling? Do you want to run? Are you scared? Are you just tired? And notice and accept your own experience in that moment. You don't have to try to change it. You just have to notice it with some compassion for yourself. And that might be something as simple as saying to yourself, I'm really tired right now. Knowing thyself also means knowing where you tend to get stuck when validating. So we all have more trouble with some feelings than others. Common ones that people have difficulty with are validating hopelessness. So this idea of if someone says to you, there's no point, I'm giving up. It's really hard. We immediately want to say, no, don't give up. I believe in you. For me, it's anger. I struggle with validating anger quite a lot, especially if it's my child and it's directed at me. Okay, so know thyself. Then once you notice what's happening inside of you, you jump into that person's shoes and you just start guessing. No wonder you're feeling that way because no wonder you're feeling scared. And the key here is that really there's no way of knowing with any absolute certainty that you're going to get it right. But you follow your gut and you use the information that you might have and you just start. And if it's wrong, it's okay. It's really about the other person seeing that you're trying to understand. My 3-year-old is so used to me doing this with him that he'll actually correct me without being mad at me, but he'll correct me to kind of help me along to understand him better. So you don't have to be perfect. And you'll know when you're getting close because you'll see some softening around the edges. You might see them start to get teary-eyed or something like that. Then tip 4 is to transform the word but into because. So do not use the word but. I understand that you're feeling sad, but you know what? You just gotta whatever. Okay, now we're out to lunch and we're totally not validating at that point. So instead of but, try to use a lot of because. See if you can come up with 3, 4, or 5 becauses. And again, it almost doesn't even need to make sense. You're just trying to validate. It's not agreement. You're just trying to figure out why it makes sense that they're feeling the way they're feeling. The next step is to pay attention to your body and voice. So we often give away things non-verbally that we don't realize in what we're saying. So you might be saying all the right things, but if you're kind of halfway out the door and you're trying to validate someone, they're going to know that you're feeling nervous or that you're scared and that you're not there with them in that moment. So watch your body language and watch your tone of voice. You don't have to try to make yourself sound like a therapist. Just speak the way you normally would. And lastly, avoid going for the bright side. Don't explain with logic or try to correct their reality. Remember, they have to feel it to heal it. So if that child feels like a loser, they need to feel that. And for me, remembering that validation and agreement are not the same thing helps quite a bit. So we're asking you to validate the emotion, not to agree with the content. So that child who says, I'm a loser, if you're agreeing, you're going to say, you're a loser. And that's not what we're talking about. We're talking about saying something like, well, of course, I can imagine you're feeling really lonely right now. I mean, everybody wants to have friends, and this year has been really hard. I mean, your best friend left school. And so just because why it makes sense that they feel like a loser without you necessarily agreeing. So I want you all to go home, although you actually are probably home given our circumstances right now, and reflect on yourself. What is hardest for you to validate? Is it self-blame? Is it anger? And remember, the biggest obstacle to us effectively validating is our own fear. And it's okay to mess up when trying to validate. Sometimes messing up and the repair that happens after is actually what builds stronger bonds with each other. So here's what we know for sure. Mental health issues have a huge impact on children and families. Caregivers don't cause mental health issues. Causes are far more complex. And at the same time, low parental self-confidence and emotion avoidance can contribute to the problem. And we know that this is something we can change with advanced caregiving. This is what we've been seeing in the research that we've been doing. So just before ending off, I'm going to give you a moment to read through some quotes that parents have shared with us who have attended a workshop either through the Family Psychology Center or through the SICKIDS Center for Community Mental Health. I'm not going to read them out loud, but I'll give you a moment to read through what some of the parents have had to say in response to the work we've done with them. And so my final thoughts for tonight is that I want to invite you to look inside yourself, to get to know your own hurt and unmet needs, because attuned parenting makes the world of a difference. Imagine what it would have done for you. Therapists may be experts in child psychology, but they are not the expert in your child. And you, the parent, are the most important person in your child's life. It's not your fault that your child is struggling, but somehow you are the one with the greatest power to support your child. for any clinicians here with us today, remember that caregivers need to be placed at the heart of their child's mental health care. So let's bring them out of the waiting room and invite them in. Thank you. And I'm just going to leave this up, maybe, if people are interested in resources. I don't know how to share that with everyone, but you let me know if you want resources.
Yeah, we can add those to the description on YouTube, and we can add those to potentially the chat box if you want to add that to chat as well, if you want to just drop the link in there.
Sure, wonderful.
So thank you so much. That was great. Lots of good information. If you guys have questions for Kristina, go ahead and open up chat at the bottom of your screen and type it in. While we're waiting for some questions to come up, I figured I have you here, I might as well ask you a question. Mm-hmm. So what do you see as, when you're working with parents, what do you see as kind of the places where you get the most resistance when you're trying to kind of like teach some of these skills, or kind of like really bring them in, or work with someone? Where do you see the most resistance coming from usually?
Yeah, well, I think the biggest thing are these emotion blocks, and they look so different for different parents. And it really depends on their upbringing. We often see parents who don't want to deal with emotion, and often their block is, well, I didn't get that when I was a kid and I turned out okay, even though they struggle with emotions. So I think a lot of it is sitting with them to kind of understand where those blocks are coming from and actually identifying them as blocks. And that often means working with them on their own stuff. So in the moment in the session, we might actually pause whatever skill they're trying to implement with their kid. And we say, okay, I want you to think about, where did you learn this? And like, what was it like for you? Do you remember as a kid when you were feeling really upset and you didn't get that support? Like, what was that actually like for you? Can you talk to that child part of yourself? And we do this really interesting thing. It's hard to imagine without being able to see it, but we have like empty chairs where people kind of go in and they talk to this empty chair, which represents their child self. And so we really get them to recognize why this feeling, this fear that they're going to not prepare their kids for the real world if they're not tough enough, is actually coming from something that they didn't get when they were younger. Yeah, so I would say that's probably the biggest one. And that's probably the biggest one that I get as a clinician. Like, I get kind of nervous when they're like, I don't want to do this. I don't see the benefit of this. But then you have to work on your own blocks as a clinician to say, okay, why is this so scary for me?
Yeah, that response of toughening them up for the real world, or I didn't get that and I turned out fine. I hear that so much, and it's just so interesting how, when you can kind of turn it on its head, like you were saying, that how much of a difference that can make sometimes.
Yeah, absolutely.
Give it a second for questions to roll in.
Yeah, I'm just going to also copy and paste some of this.
Yeah, definitely throw in those resources. So Paige has a question. First, she says, great presentation. So she asks, when we get it wrong with validation, how do we repair? What do you suggest to how to repair?
Yeah, so I guess that depends on how things unfold. So what we often see is, if you don't practice validation frequently, and you're doing it with someone who's not used to it and you get it wrong, they might actually respond with anger. So it can be really tricky. So it sort of depends on the situation. So if someone responds with anger, you then kind of switch to validating that, like, I got it wrong. Clearly I got it wrong and something else is going on. And then you just keep trying. And you will eventually start to notice, when you're getting closer, the shift in that person. What I do find is, when you do it and the person knows that you're genuinely trying to understand, is that they might actually just help you along. So the example I was thinking about with my kiddo, I mentioned that anger is really hard for me. So sometimes I see anger when there isn't anger there, just because anger is such a trigger for me. And it's gotten to the point where, if I'm trying to validate my kiddo and I'm like, God, you're feeling really angry with me right now, he'll actually stop and say, no, mommy, I'm feeling frustrated right now. And so he'll correct my validation, and he's not upset at me for getting it wrong. He's trying to help me along. And so when you get it wrong, you just keep trying, and eventually something's going to stick. And if it doesn't that first time, that's also okay. Maybe the person's not used to it. Maybe they're just not ready yet. And you come back a different time and you try it again.
So validating the invalidate or feeling invalidated, right? The meta validation.
Yeah.
So our next question is from Grace. She asks, is emotional focus therapy something you need to be certified in? Or if you could just talk more about the process of learning it or anything like that.
Yeah, for sure. So so yes, you would do sort of some training in providing emotion-focused family therapy, and there's different ways you can do it. Through York University, we do offer often like a several-day training with one of the developers of EFFT. My good friend and clinical supervisor, Dr. Maurice Ferrogi, she also provides clinician training. For those of you who aren't sure if you're interested or not, there's also an option of observing workshops. So you can attend just as an observer to watch the workshops unfold. So you actually see the clinician working with these families and what all of the moving pieces look like. And then if you're interested in it, you can then attend sort of a more advanced training in emotion-focused family therapy. So yeah, it usually is, there's different levels of training. The first level is sort of basic, and then your advanced training, and then you're training to be a trainer. So you can kind of attend these several day training opportunities to become certified in EFFT.
What a cool opportunity to kind of like watch a workshop and not worry so much about the if you're not sure. So Shelby has a question. So she says, instead of guessing why your child is feeling what they're feeling, are there times when you would or should just ask them how they're feeling or feeling that way or where that feeling is coming from?
Yeah, that's a really good question. And I would suggest avoiding asking. I think that you're better off guessing and getting it a little bit wrong and then keep going and getting some feedback. I think when you guess, usually the person will give you something back. And I guess it also depends on the age of the person. I mean, I would ask my husband, I see you're upset. I'm wondering how you're feeling right now. And I might not say, tell me how you're feeling, but I might say, I'm trying to figure it out. I'm not too sure. And I'm wondering how you're feeling right now. And that would be okay. I think with children, it's a bit different. I find if you're asking a 5-year-old while they're upset what they're feeling, they may actually not know. And so when we validate, we're also kind of teaching them about emotions. So if we say something that hits with how they're feeling, they'll say, yeah, I am feeling whatever it might be. But if you ask them, they may not be able to tell you. So I would say most of the time, I would try just to validate rather than ask. If you're not sure, you can say that. Like sometimes I say that with my clients. I say, I'm just noticing something's happening right now. You seem emotional to me. I'm wondering what is happening. I'm wondering what you're feeling. So you can ask, but I think that when you show them you're trying to attune to what is happening to them and validating, that can be more powerful. And also that validation always has a sense of like being hesitant. You're not saying you're feeling like for sure you're angry at me, because we never really know for sure. So we kind of approach it in this way that's soft and leaves room to show that we're kind of wondering about it and we're not too sure, and we're checking in with them. Is this what's going on? I hope that answers your question, Shelby.
Shelby says that makes a lot of sense. Thank you so much. And Grace also says thank you. So looks like we are out of questions. So if you have a question, type it in quickly while I talk very slowly. But Christina, thank you so much for coming on and talking about this. Thank you for for those of you in attendance. There's some info in the chat for you. But I think we learned a lot, and I'm really excited to learn some more information or look some of that stuff up as well. So thank you very much.